In our last discussion, we touched upon the titans of nursing history, Florence Nightingale, Mary Seacole, who fundamentally reshaped the profession. Their stories are essential. They laid the groundwork for modern nursing through sanitation, data, sheer determination. But nursing history isn't just famous names, it's the countless individuals who stepped up in crisis, driven by a deep sense of humanity. One unexpected figure is Walt Whitman. We picture him as the bard of democracy, the author of Leaves of Grass. We don't picture him at a wounded soldier's bedside, changing bandages, offering comfort. Walt Whitman's journey into nursing began in December 1862. He traveled to Washington, D.C. after reading his brother George's name in a list of soldiers wounded at the Battle of Fredericksburg. While his brother's injuries turned out to be minor, Whitman was profoundly moved by the immense suffering he witnessed in the makeshift military hospitals. He saw legions of sick and dying young men, often neglected and in agonizing pain. He decided to stay, committing himself to serve as a volunteer nurse for the next 3 years. He became a familiar and comforting presence in the wards, earning the nickname the Good Gray Nurse from the soldiers he tended. His nursing work was not glamorous. It was gritty, hands-on, and emotionally draining. Whitman did more than just offer words of comfort. He dressed wounds, helped soldiers write letters home to their families, brought them small gifts like fruit or tobacco, and simply sat with them, holding their hands as they faced their final moments. History, as we have seen with Walt Whitman, is not just about the actions of key individuals. It is also powerfully shaped by how those actions and the people who perform them are perceived by the wider world. The story of nursing is a perfect example of this. The profession has been defined as much by public perception and cultural narratives as it has by the work of nurses themselves. These perceptions, often simplified and translated into stereotypes, create a kind of cultural shorthand. They influence how patients interact with nurses, how policymakers value the profession, and even how young people decide whether to pursue nursing as a career. These broader perceptions are built over time through stories told in books, newspapers, films, and television shows. For every real-life Florence Nightingale or Walt Whitman, there are a dozen fictional characters who shape imagination. The power of these stories is immense because they tap into fundamental human emotions and archetypes. This is why understanding these narratives is so critical. They are not just entertainment, they are powerful social forces. Over the years, a handful of powerful and persistent stereotypes have come to dominate public perception. These myths are not harmless fictions. They actively distort the reality of a complex, demanding profession. One enduring image, the angel of mercy, a purely altruistic, self-sacrificing figure, caring from innate kindness rather than professional expertise. Gentle, compliant, emotionally driven, gliding through wards with a beatific smile. While compassion matters, this image erases intellectual rigor, scientific knowledge, and critical thinking, essential to safe, effective care. At the other extreme, the battle axe, a cold, authoritarian caricature who terrorizes patients and staff, and the naughty nurse, sexualized, reduced to a fantasy concerned with flirtation over health. These portrayals demean the workforce and trivialize life and death work. The media has honestly been the primary factory for producing and perpetuating nursing stereotypes. For decades, film and television have presented audiences with a parade of characters who embody these myths. In the 1970s, one of the most famous nurses on television was Major Margaret Hot Lips Houlihan From MASH, played by Loretta Swit, she started out blending the battle axe and naughty nurse stereotypes. She was a rigid, by-the-book head nurse who was also defined by her romantic relationship with a male doctor. While the character did evolve, her initial portrayal reinforced problematic ideas about female nurses in a male-dominated world. The 1975 film One Flew Over the Cuckoo's Nest gave us Nurse Ratched. As portrayed by Louise Fletcher, she was the ultimate battle axe. Cold, cruel, and manipulative, she used authority to break spirits. Nurse Ratched became a cultural icon of tyrannical power. More recently, television offered more nuanced, though still problematic, portrayals. Nurse Jackie presented a brilliant, fiercely dedicated ER nurse whose personal failings fueled a troubled nurse narrative. These portrayals create a confusing, contradictory public image. So one might be tempted to ask, so what? They're just characters on a screen, right? But do these myths and stereotypes really have any tangible impact in the real world? The answer, honestly, is an emphatic yes. Misrepresentation of nursing in media has serious, far-reaching consequences. It affects patient safety. It affects public health. It affects the sustainability of the nursing profession. When the public sees nurses primarily as kind-hearted helpers or doctor's assistants, they fail to appreciate the education and critical thinking the job requires. A patient might not report a subtle change to a nurse waiting for the doctor. They don't realize nurses monitor around the clock and can act immediately. Dismissing nurse guidance can lead to medication errors, infections, readmissions. The angel myth drives unsafe ratios and underinvestment in education and leadership. Myths deter candidates, fuel burnout, and threaten the profession's future. For years, nurses have consistently ranked as the most trusted profession in public opinion polls. People overwhelmingly believe nurses have high honesty and ethical standards. However, there's a dangerous disconnect between trust and understanding. Research by Suzanne Gordon and others highlights this gap. A key study found the public trusts nurses but knows little about education, scope, or the autonomous role nurses play in care. Many don't know an RN earns a degree, passes licensure, and pursues lifelong learning. Nurses conduct complex assessments, interpret labs, manage technology, and make independent judgments that can mean life or death. The public trusts the person but doesn't understand the profession. Media emphasizes emotion while hiding scientific work. Emotional support without institutional support changes little. We must move beyond simple trust and build genuine public understanding. To counter the myths, we need real data on the modern nursing workforce. The numbers tell a far more complex, diverse story. While nursing remains predominantly female, gender demographics are shifting. In 2014, about 1 in 10 RNs were male. In 2023, that number grew to over 13%. The average RN age is around 52, an experienced workforce facing retirements. Roughly 73% identify as white, with Hispanic, Black, Asian, and multiracial nurses growing in number. Increasing diversity is essential to culturally competent care. Hospitals employ the largest share of RNs, but about 40% work beyond hospital walls. Physicians' offices, outpatient clinics, nursing facilities, residential care, government agencies, schools, correctional facilities, corporate offices. Nurses are researchers, educators, policy advocates, and public health leaders. Median RN pay in May 2023 was about $86,070. varying by location, specialty, education, and experience. We've journeyed from Civil War battlefields to the halls of modern hospitals, from the poetry of Walt Whitman to the primetime dramas of today. One theme emerges: the image of nursing matters profoundly. The gap between fictional and real nurses is a public health issue. When people see nurses as highly educated science professionals, they partner more effectively in their care. Accurate portrayals of critical thinking, autonomy, and leadership can literally save lives. Realistic images also secure funding and political support for staffing, safety, and research. They attract the next generation: leaders, innovators, scientists, and fierce advocates. The real story of nursing is intelligence, courage, and relentless dedication. And honestly, it's a story that deserves to be told, for nurses and for us all. We'll keep peeling back myths to reveal the complex, heroic reality of 21st century nursing.